Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various concerns connected with hair care. Our hair is a crowning glory and it takes a world of difference to make our appearance very different. However, our hair also requires special care and attention. Earlier, it used to be a problem of middle age when you used to lose hair of a thinning hair or a bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see hair problems occurring at a 25 to 35 years old people, and most of these problems, if identified early, can be manageable and much of the hair loss can be avoided. Today we have with us Dr. Mugdha Mohan is a well-known dermatologist and has been practicing medicine for over many years now. She's MBBS, MD and specializes in dermatology, cosmetology and hair transplant. Currently she is practicing as consultant dermatology at Skincare Center, Bettiah, Bihar. Dr. Mugdha Mohan has dedicated her career to diagnosing and treating a wide range of skin and hair conditions by providing personalized haircare services to her patients. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Mugdha Mohan is also aware of the need for the patient awareness and education about hair care and skin care. So she has spent a lot of time in giving talks at a various platforms across the country. Thank you, Dr. Mugdha Mohan, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to this YouTube live show on
Thank
hair
you.
care.
Thank you so much for having me.
So, Dr. हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So, Doctor, today we are going to talk about hair care in current scenario, and whenever we talk about hair care in current scenario, the first and the foremost problem जो हम सब face करते हैं, irrespective of gender and age, is the hair loss. So, please can you enlighten us with your profound experience कि ये hair loss होता क्या है and what's normal and meant to be concerned for?
Okay, so we say that if you are losing 50 to 100 strands of hair every day, it is considered normal. But if you're consistently shedding more hair for a significant amount of time, then you should be concerned. Usually, it's telogen effluvium in clinical term, which we say diffuse hair fall. So many causes are there for diffuse hair fall. It can be, post stress. If your body is going through any sort of stress, mental stress or physical stress, viral fever, if you are having any surgeries, then you'll experience hair fall after that, and not during the period of stress, usually 2 to 3 months after that. Then you should be concerned and you should visit a dermatologist for proper guidance.
Okay, so anytime we are facing severe hair fall and due to some infection or due to any other problems, we should at that time we should visit to the doctor instead of just avoiding it and making
Absolutely.
it worse. Okay, okay, that quite interesting, doctor. So now that we know what's hair loss and when to be concerned for, another question, people who are prone to hair loss and hair fall, they always ask this question to themselves, like, why me? Why it is happening to me? मेरे साथ ही क्यों हो रहा है ये? क्या problem है मेरे अंदर? So can you please enlighten us what are the general causes of hair loss?
As I mentioned, any nutritional deficiency can be there, which is very prevalent in our population. Usually there can be iron deficiency. Anemia is a
Mhm.
major cause of hair fall, or any other micronutrient deficiency, because we take carbohydrates and all, but our Indian diet is not very rich in protein. So
Mhm.
protein is very important. So this is one of the cause, that nutritional deficiency. Other is if you are having stress, mental stress, if your sleep
Mhm.
habits is not regular, then
Mhm.
also it will result in hair fall. And most common is genetic pattern,
Mhm.
pattern baldness, which we call in clinical term, like hereditary androgenetic alopecia in men. That is one of the cause. Nutritional deficiency, genetic factors, stress,
Mhm.
pollution also, and
Mhm.
any acute infection, viral fever. This all can result in hair fall.
Mhm.
Postpartum also, hormonal changes. These are all causes.
Okay, okay. So there are many causes, and the most problem is like hormonal problem can also lead to hair loss.
Definitely.
Okay. So, doctor, you talked about lifestyle and you said that lifestyle also play a major role. So nowadays we are so busy, we don't have time to have a good lifestyle and hectic schedules, and we don't pay attention to what we are eating and not eating. So can you please elaborate or explain us more that how does this person's lifestyle play a role in hair loss?
Yes, because if you're having a very stressful life, your stress hormones increases in your body, and it
Mm-hmm.
can indirectly uh, results in hair fall. So you have to be stress free for many other reasons as well, not only for hair care.
Okay.
And how can you maintain it if you're not having a proper diet? You can
Mm-hmm.
add few nuts and dry fruits and all to combat your micronutrient deficiency. So this is
Mm-hmm.
very easy. You can just take it in a go, and you can take a handful of nuts and seeds, and this will
Mm-hmm.
help in your dietary nutritional deficiency.
Okay, that's quite interesting. So, diet and nutrition is very important, and we should eat good so that we can fulfill all the nutrients. So, doctor, like after that, now that we know we have discussed about hair loss and the causes and the diet and nutrition, another very common question and also very confusion among the people that what are the medical treatment options available for hair loss, and quite confusing, and people also get fool around that by very various other sources like जो ट्रीटमेंट नहीं होता है वो कुछ और भी करवा लेते हैं and then they think that अच्छा कोई result नहीं है. So can you please enlighten us what medical treatment options are available for hair loss, like surgical, non-surgical, or any other treatment options available which we can eat and manage our hair loss problems?
Yes. एज आई मेंशन्ड अर्लियर, जैसा मैंने बताया कि हेयर फॉल के बहुत सारे कॉजेज हैं। तो सबसे पहले तो पर्सन को असेस करना होगा कि किस कारण से उसके हेयर फॉल हो रहा है, and then we'll assign them the medical or surgical. If there is persistent hair loss for 5 years or more, then we can go for surgical, which is hair transplant, as we all know. And for medical treatment, we all have different medicines which we prescribe to patient as customized. If any person is having nutritional deficiency, we'll get some lab tests done, then we'll prescribe them the supplements. If person is having hereditary or genetic pattern baldness, then minoxidil is the option. We cannot do without minoxidil in those cases. So these all our options are available. Also, these days we have few procedures like platelet rich plasma that we prescribe to patient, which can result in hair growth faster and better. And then hair transplant is the surgical option, as we all know, if you have persistent hair loss for more than 5 years.
Okay, so wide range of treatment options are available. It just we need to know the root cause so that the right treatment can help us to grow the hair back or get the hair back.
Yeah,
Okay,
definitely.
so doctor, after like you said about like nutrients and diet, and there is one word called nutraceutical which is getting a lot of focus nowadays. So can you please tell us like what is this role of this? What is this nutraceutical and what is the role of this nutraceutical in hair health?
Nutraceuticals most commonly, which is being prescribed and also to some extent being abused these days, is biotin.
Mm-hmm.
Biotin is also nutraceutical. All the micro and macronutrients which you need for hair growth, which come into pharmaceutical category, those are nutraceutical. Pharmaceutical products which have nutritional supplements, which are nutritional supplements, those are nutraceutical, to understand in simpler terms, which can be micronutrients like selenium, zinc, other vitamins, amino acids, and all, and macronutrients as well. If the person is taking enough carbohydrates, enough protein, and all,
Mm-hmm.
that's one thing.
Okay, okay. So, doctor, like on internet and social media, there are so many herbals and these plant extract and phytoconstituent like grapeseed and omega fatty acids. So, do they promote hair growth and are they useful in managing alopecia?
Yes, they do promote omega-3 fatty acid is a good source, for controlling hair fall, but alone it cannot do anything. You have to
Okay.
use these adjuvant drugs. That's why these are supplements. You have to
Mhm.
take them, but you have to take other medicines as well. Alone, these cannot do anything.
Okay. So these are like सिर्फ ये सोच के खाते रहो it won't work.
नहीं, समटाइम्स ये सब आपके लैब टेस्ट्स में भी ऑल्टरेशन कर देते हैं, लाइक बायोटीन अगर बहुत क्योंकि आजकल इतना कॉमन हो गया है,
Yeah.
कहीं भी बिना प्रिस्क्रिप्शन के भी मिलता है। ये सप्लीमेंट ही था इस वजह से, लेकिन अब उसकी वजह से आपको बहुत बार लैब टेस्ट भी ऑल्टर्ड मिलते हैं। तो
Okay.
excess of anything is not good. That's what we should do.
Okay. Okay, excess of anything is not good. So, doctor, like before you said, this micronutrients play a very important role in our like health wise. And can you please explain us, because we as a common people we don't know what is this macro or micronutrients. So, can you please explain us what is this micronutrients and what is the role of this micronutrients in our hair health?
Okay, micronutrients are vitamins and minerals.
Okay.
Okay, so like vitamin A to A, B, these, in fact B also, it's very play a important role in your hair fall and hair growth cycle. Okay, so vitamins हो गए and minerals like selenium, zinc, ये सब आपके मिनरल्स जो है ये सब भी आपके आते हैं माइक्रोन्यूट्रिएंट्स में। तो विटामिन्स एंड मिनरल्स आर माइक्रोन्यूट्रिएंट्स, एंड प्रोटीन, कार्बोहाइड्रेट्स, ये सब जो फैट्स, ये सब आते हैं आपके मैक्रोन्यूट्रिएंट्स।
Mm-hmm. ओके एंड ये लाइक माइक्रोन्यूट्रिएंट्स हमें डाइट से मिल जाते हैं आराम से या फिर हमें अलग से सप्लीमेंट लेना जरूरी है?
अलग से सप्लीमेंट लेना पड़ता है इफ यू आर फेसिंग एक्टिव हेयर फॉल। डाइट से मिल जाते हैं, लेकिन ये तो फिर डाइट तो डिपेंड करता है ना कि सबका कैसा है। ऑल पीपल आर नॉट टेकिंग द सेम डाइट, है ना। मे बी सब लोग हेल्थ कॉन्शियस नहीं हो। अगर आप ज्यादा जंक फूड ले रहे हैं, फिर आपका डाइट से कैसे मिलेगा? तो फिर आपको सप्लीमेंट लेना पड़ेगा। आपने जैसा पहले बोला कि हम लोग आजकल ऐसे ये फास्ट लाइफ में चल रहे हैं, तो क्योंकि जंक फूड ज्यादा ले रहे हैं इस वजह से हेयर फॉल भी ज्यादा देखने को मिल रहा है। हमारे कन्वेंशनल डाइट में तो मिल जाता है, लेकिन आप अगर जंक फूड ज्यादा लेंगे तो ये नहीं पूरा हो पाता, तो फिर आपको लेना पड़ेगा सप्लीमेंट्स।
Okay, okay. So supplements can help us to make those nutrients up to the mark in our body and
यस, डेफिनेटली।
yeah. Okay, so doctor, like nowadays, like there are so many products on the social media. So people, what they do is, I see like most of the people they eat gummies and they don't pay attention to how much they are taking and how much they are not taking. They just think that okay, I'll take it, and my hair will grow back. So is it required to take these nutrients as per gender RD requirement or under the supervision of doctor, or we can buy by ourselves and take it?
You should always visit a doctor first, because as I mentioned, there are different reasons for hair fall. Different major causes are for a different person. There is different cause. So first you will have to visit a dermatologist. They will assess the cause and then they will provide you with supplements. Most of the cases, maybe you don't need a supplement. Maybe you are having a healthy diet and it's been fulfilling your all needs. But uh, people tend to use influenced by social media all the supplements like a regular basis, which is not advisable.
Okay, okay, quite interesting. So, doctor, like now we have talked about hair loss and the causes and nutrients use and how do we take. Another very common problem which is faced by all of us is the dandruff. So, do we need to take dandruff very seriously, and does it can the like does it can cause various problems like hair fall or hair loss?
Yes, dandruff can cause hair loss. So you have to use an anti-dandruff shampoo regularly for a longer period of time, because dandruff does not go away very easily, as I must be honest. Okay. So you have to use products according to your hair type. That's very important. If you're facing dandruff, then you'll have to use anti-dandruff shampoo
Okay.
regularly.
Okay. Okay. And can dandruff go by anti-dandruff shampoos or we need to visit the doctor?
If it's not going away by using your OTC products, then you should visit a doctor. They will prescribe you some pharmacy drugs
Mm-hmm.
for dandruff, and then it will go away. But you have to be consistent. That's all.
Okay. So medical adherence is important so that we can get rid of dandruff.
Because then if you're having a severe dandruff, or and many times it's not dandruff at all, it's something altogether, it's a different disease. So
Yeah.
to visit a dermatologist is always necessary, because they will assess it if it's dandruff or it's a different thing. Like in psoriasis also there is flakiness, in psoriasis also there is some buildup on the scalp, but it's not
Mhm.
always dandruff.
Okay. Okay, so doctor, you said that stress play a very important role in our health, including hair health. So can you please elaborate little more, like what is this impact of stress in our hair health?
Yeah, stress can alter with your hormones and it can eventually result in your hair fall. So, exercise daily, do yoga or anything like that, and at least walk for 10 to 15 minutes, do meditation, and keep your life stress free, not only for hair and skin, for every other organ also.
Okay. So doctor, like when we are stressed out, the very common solution given by like a lot of the mothers at home, like do the oil massage, get the get, you will be stress free or stress relief. And they also say that put lot of oil, next day morning when you will get up you will have a stronger and thicker hair. So do you think that oiling hair is a boon or a ban, or what's the fact around this?
You should oil your hair for relaxation. Champi is definitely beneficial for relaxation, but dermatologists, we doctors, we do not advise you to keep your oil overnight because it can clog your pores and it can cause acne, especially on forehead area if the oil trickles down. Okay, so do your oil massage, keep oil for 3 to 4 hours, and then wash it off.
Okay, so like before doing shampoo, put the oil and then
Yes,
wash it instead of keeping like overnight and thinking that next day morning the oil the hair will
it
grow.
can result in other problems.
Okay, so now, doctor, my favorite part. Can you please give us some important tips for healthy hair?
Okay, as I mentioned in your session, that take a nutritious diet, protein-rich diet, your increase your protein intake because our diet is deficient in it. Take nuts and seeds, regularly, and keep your life stress-free. Do meditation, yoga, and that's all. And do not self-prescribe you any medicine. And I always visit a dermatologist. Do not self-prescribe. That's another thing.
Okay, so doctor, the discussion was very informative. I'm sure the viewers have found the session very helpful. So can we take some live audience questions?
Sure.
Okay, the first question is, hello doctor, how to know if my hair follicles of bald patch are alive or dead? I reside in a small city with dermatologist of repute. What treatment is effective for this?
For thinning of hair, his question is what treatment is effective for thinning of hair. Okay,
Yeah,
so we you that he or she, whoever he or she is, needs
he's
to visit a dermatologist first. Then
mhm,
they will assess how much hair fall is there, how much hair have thinned out because we use various scales for alopecia, that is
mhm,
hair fall. We use
mhm,
various scale for male and female. Different scales are there, and and different grades are there. Then we'll assess the problem. Then we'll give solution. There are
mhm,
many serums available which can cause you hair growth, but you
mhm,
have to be consistent. You cannot
mhm.
get results in 1 to 2 months of time. That's for all. You have to be consistent with your prescribed medicines.
Okay. Okay, so consistency is very important with the
When it
with
comes to hair care or skin care, consistency is the key.
okay. Okay. Another question from our audience is, Doctor, one of my friend is facing issue of hair fall in rainy season. So PRP treatment will help in reducing this kind of hair fall.
Yes, PRP treatment will definitely help. However, lose few hair in monsoon season is acceptable because
Mhm,
humidity has increased and it can affect your hair. So most of the people face more hair fall during rainy season.
mhm,
PRP is very effective. You can go for PRP sessions and it has no side effects because your own blood is used in this. So
mhm.
PRP is effective. You will see very faster hair growth and also improvement in texture.
Okay, very interesting. Another question from our audience is, हाय डॉक्टर, मैं भी बिहार से हूँ, आपका अपॉइंटमेंट लेने के लिए क्या करना पड़ेगा और मुझे एंड्रोजेनिक एलोपेशिया है, मैंने बहुत सारी मेडिकेशंस ली, मेरे बाल वापस नहीं आ रहे, मुझे क्या करना पड़ेगा?
तो आप बेतिया में हॉस्पिटल रोड में है ये हमारा क्लिनिक, बेतिया हॉस्पिटल रोड में स्किन केयर सेंटर। आप वहाँ पे आकर के कभी भी अपॉइंटमेंट ले सकते हैं, कभी भी विजिट कर सकते हैं। फिर आपका प्रॉब्लम कितना सीवियर है वो असेस करने के बाद आपको आगे का ट्रीटमेंट बताया जाएगा। जैसा बहुत सारा ट्रीटमेंट ऑप्शन अवेलेबल है हमारे पास, हमने बताया आपको पीआरपी, इनफैक्ट आजकल जीएफसी भी अवेलेबल है हमारे सेंटर पे। आप ये सब कुछ भी करवा सकते हैं विथ ऑब्वियसली प्रिस्क्राइब्ड मेडिसिन, the serums, the tablets you have to take.
Okay. So, like, not only medication, but therapies are also very important.
Yes.
Yeah. Okay. And the question from our audience is, hi, doctor, I have low ferritin and low B12 and D3, and I'm 20 years old. Can this lead to hair thinning and baldness because I'm facing these problems?
Yes, low vitamin D can cause you hair thinning. You have to take supplements, vitamin D supplements for at least 6 to 8 weeks. You should take because it can affect your hair thinning. Also, it can result in graying of hair, premature graying of hair also.
Okay. Hi, doctor. My daughter is 12 years old and she have lot of hair, gray hair. So can we stop this, and can I come to you to stop this?
Yes, we will need to assess few vitamin tests for her. As I mentioned, vitamin D deficiency can lead to premature graying of hair. Also, there are genetic factors involved, and you can always visit at my center, Skincare Center, Hospital Road, Bettiah, for further assistance.
Okay, I take the last question quickly. Hi, doctor. I'm a diabetic patient and I want to go for a hair transplant. So can I go for it because I have diabetes and I take a lot of medication? Will transplant work on me?
Yes, you can go for hair transplant, but the transplant surgeon will take other precautions as well as the patient is diabetic, because in diabetic patients, chances of infection are higher. That's why the hair transplant surgeon, he himself or she herself will take the necessary precautions for diabetic patient. But it is absolutely safe for go for hair transplantation, but precautions must be taken.
Okay, so the doctor know what kind of a precautions need to be taken with patient who have
Yes,
other.
they will put on antibiotics and everything, and they will make them understand what precautions to be taken.
Okay, quite interesting, doctor. So finally, would you like to give some take-home message or any other suggestion to our viewers today?
If you're facing hair fall, that's my suggestion. Take nutritious diet. Do not self-medicate, and do not get so much influenced by social media. There are many products available, but it's not necessary that everything will work for every person. So that's all.
Okay. So खुद का डॉक्टर नहीं बनना है, हमें डॉक्टर को विजिट करना है और चीजें अपना
Definitely.
treatment लेना है.
Give us a chance and then see the results. You will definitely see better results.
Yeah. Most of the people do that. They will spend a lot of money buying those products, and later on they will cry that okay, nothing
Yes,
is
and they
working.
don't realize that with money there is also they're losing time as well.
Yeah. That's very important. Time is also very important. Quite interesting, doctor. Thank you so much for sharing your expertise and all the information with us today and answering all the questions of our viewers today. I'm sure the viewers have found the session very helpful. And thank you, doctor. It was delight to have you. And thank you so much for your valuable time.
Thank you so much for having me. Thank you.
Thank you, ladies and gentlemen, for joining us today and asking so many questions and participating so actively. I'm sure I haven't taken all the questions, but yes, we'll take the appointment of our doctor again with a new topic on hair care or skin care, and we'll discuss it more in future. So we are signing off for today. Thank you. Bye.